the bronchus diameter in a horse with an asthmatic condition is narrow, especially if it's an active asthmatic condition, it narrows, and that has a huge amount of effect on how easy it is to pass air in and out of the lung. And so that is the internal hallmark of an asthmatic condition. And externally, a person looking at a horse with heaves, they all know that the horse recruits the abdominal muscles in order to exhale air. And so that's the heave line that results in the heave line. The horses with severe asthma are not able to easily move air out of the lung, but they have to really push and recruit their abdominal muscles. And so a reduction in the diameter of the airway has a huge effect on the ability to pass air in and out of the lung. The secretions are a secondary sign that reflects inflammation. The diseased or irritated epithelium produces excess mucus. There are neutrophils in the very lower airways, in the bronchioles and in the alveoli, and they contribute to the inflammatory component and the secretions.